Begin by repeating the case directive to set the stage for your discussion. You might say, "I was asked to perform a cranial nerve examination on the patient," or "Mrs. JW is a 50-year-old female who presented with headaches. I was asked to perform a cranial nerve examination and proceed." If you don't recall every detail, focus on accurately conveying the specific system or area you were instructed to examine. Next, provide a succinct summary of the key findings from your physical examination. For example, you might state, "The most likely diagnosis is aortic stenosis, given the presence of an ejection systolic murmur heard loudest in the aortic area and radiating to the carotids." This summary should immediately capture the examiner's attention and demonstrate that you have a clear grasp of the case. Then discuss the differential diagnosis for your key findings. Explain that for a systolic murmur, differentials might include mitral regurgitation, which typically presents with a pansystolic murmur, best heard in the mitral area with radiation to the axilla, and hypertrophic cardiomyopathy, which often presents with a harsh systolic murmur at the left lower sternal border that increases with manoeuvres such as the Valsalva and decreases with squatting or hand grip. Clearly differentiate these conditions by emphasising the specific features that support or rule out each diagnosis. Following this, elaborate on the features of severity and possible aetiologies. Describe the intensity of the murmur and any associated clinical signs, and comment on potential causes. For instance, in an older patient, aortic stenosis is most commonly due to calcific degeneration, whereas in a younger patient, you might consider an underlying bicuspid aortic valve leading to premature calcific degeneration. After discussing the differentials and severity, briefly recapitulate the key elements of your physical examination. Make sure to mention both positive and negative findings to demonstrate a thorough assessment. This recapitulation acts as a bridge to your problem list and further discussion, ensuring that the examiners see that you have carefully evaluated the patient. Next, outline the investigations you would recommend to confirm your suspected diagnosis and assess the severity of the condition. Discuss potential management plans briefly, providing a rationale for your choices that is tailored to the patient's clinical context. This part of your discussion shows that you have considered both the diagnostic process and subsequent treatment strategies. Throughout your discussion, maintain a smooth and flowing narrative by integrating all the relevant information. Your aim is to articulate your thought process clearly and concisely, so the examiners can follow your clinical reasoning without unnecessary detail. Practice your discussion until you can confidently transition from summarising your findings to exploring differentials, severity, investigations, and management within the allotted time. Finally, conclude your discussion by briefly recapitulating your main points. Reinforce your clinical reasoning and the integration of the patient's narrative with your findings, ensuring that the examiners understand you have a comprehensive grasp of the case and a clear plan for further management. This approach not only highlights your key findings, but also demonstrates your ability to synthesize information effectively, manage your time, and communicate your clinical reasoning in a coherent, structured manner, skills that are essential for both the exam and your future clinical practice.